So you have estrogenic compounds in the environment. Even many of the pesticides that are sprayed, you see correlation between high intake of sprayed foods and male infertility and even testicular cancer. I would eat organic mostly or local.
Today's guest is Dr. Geo Espinosa, a functional and naturopathic medical doctor focused on men's health and urology. In this episode, Dr. Geo shares his wisdom on ways to boost testosterone, how to prevent prostate cancer, how to improve penis health and blood flow, and his philosophies on being a dad.
So I boost T levels naturally in patients. At the end of the day, you need to get to REM sleep to produce testosterone. Period, end of story. Then what? Then is exercise. So what I've learned through research is, go exercise, not just go exercise. It's more or less stimulating big muscles. So any back and lower limbs. So weightlifting exercise is important.
In this episode, we're talking about a lot of different kinds of supplements that you can take to naturally improve your total and free testosterone levels, as well as the density of your androgen receptors. Many of the supplements that Dr. Geo recommends are things like zinc, magnesium, boron, ashwagandha, tongkat ali. And guess what? We put all of these amazing ingredients inside of our FitFather Natural Testosterone Booster RX. It is basically the formula that has all of these, plus some other great ingredients. And you take this once per day, and it naturally increases your testosterone levels, which makes your whole health work better. It makes you get better results from all the effort that you're putting into your nutrition and your exercise. It is a supplement that I'm taking on a daily basis, and I highly recommend it for everyone inside the community. So you can go to the FitFather Project store or check the links in the show notes and get Testosterone Booster RX to get all the nutrients you need for higher testosterone naturally. Let's get back to today's episode. Dr. Geo Espinosa, it is a pleasure to have you on the FitFather podcast, my friend.
Such a pleasure, Anthony. It's been long coming. Thank you so much for having me.
And I don't know if the listeners yet know that this is a true privilege to get to spend time with you as one of the world's foremost experts in functional medicine and naturopathic medicine as it relates to men's health. And in this discussion today, I want to basically pick your brain and get deep into all the topics that many guys are interested in. How to optimize testosterone, what the deal is with the prostate as we age, some penis stuff about being a dad. I know these are conversations you're so deep on, so let's get straight into it. I guess I'd love to maybe start off with the medical side of things. Like, what do guys need to be paying attention to as it relates to this prostate gland? What do guys need to know about? What are changes are happening? And what can we begin the conversation on the prostate?
Wow. Okay. So in my head, I'm like, all right, how do we do this in like maybe 2 minutes or less, right? There's three conditions that are related to the prostate, right? There's benign prostatitic hyperplasia, which is BPH. It's just an enlarged prostate. So as men get older, oftentimes, not all the times, their prostate grows. And it can become problematic from a urinary perspective. So this is the guy that wakes up 3-4 times a night, urinary frequency, you see the slow stream. The other is prostatitis. Prostatitis technically, well, most of the times affects younger men, younger than 50, younger than even 40, sometimes in 18, 20, and it kind of stays with them forever. Some men, as they get older, they get prostatitis, but it's rare. As men get older, they typically get more BPH. Younger men get more prostatitis. Then, of course, it's the C word, is prostate cancer. Right? Prostate cancer, I spend a lot of time on all of these three areas, both lecturing, researching, and seeing patients. What I would say is, I would say a little bit about each, and then you can ask questions because I want to go wherever you want to go with it. Prostatitis, I call it the Ivy League disease. And the reason for that is, I've seen a lot of Ivy Leaguers with prostatitis, but it's not the fact that they're Ivy Leaguers, it's their personality types, right? They're very kind of, intensely focused into anything that they're into. Yeah. And to get through, many Ivy League schools, you have to be very much focused and kind of be a little bit tight, or they tend to be a little bit tight. And literally, they tighten up the pelvic muscles. The prostate is 30% of the prostate is a muscle, is a smooth muscle. So they tend to tighten that up. And, prostatitis is a diagnosis of exclusion. So if you don't have A, B, or C, you have prostatitis. So it's not like there's a biomarker that says you have prostatitis. Typically, it presents with pain in the pelvic area. Sometimes they say that they feel like they're sitting on top of a golf ball. And in addition to some sort of urinary problems, urinary frequency, urgency, and things like that combined, right?
Hmm.
I think is a neuropathic problem. So these are hyperactive nerves around the area. So I
Hmm.
think that in this particular scenario, of course, you and I are naturopathic doctors. We look at things holistically,
Hmm.
but certainly as I give presentations to medical doctors, you want to look outside the prostate here. You want to look at their mind. You want to look at how they interpret situations. You know, I think that prostatitis is, I call it pelvicitis because sometimes it's their penis that's, is pain. They have pain in their penis or their testicles or their lower abdomen. So it's the same process. Is
Hmm.
over sympathetic stimulation, right?
Hmm.
Sympathetic nervous system. So the idea is how can they stimulate the parasympathetic nervous system more, sleep better. Oftentimes it's combined with gut problems. So make sure that that's taken care of. So prostatitis, people could do better. Sometimes they feel, they go to urologists, and I work with urologists. They'll admit it. They're like, yeah, we just give them antibiotics, and it really doesn't do much. In fact, it does more harm than good because we
Yeah.
know, it gets rid of the microbiome, it causes resistance and things like that. So that's prostatitis. BPH. What I would say is this is a very important takeaway. You can have a very large prostate, and just for context, maybe a 25-year-old male has a 20-gram prostate, so that's the size of a walnut
Hmm.
roughly. And I've seen a 300-gram prostate,
Wow.
so that's like an orange.
Yeah.
And so you can have an enlarged prostate but not have urinary symptoms. So I remember talking to one of my colleagues, urologist, and he said, and I asked him, I said, so if a man has urinary symptoms after a certain age, why is it that one already thinks that it's prostatitis, or not prostatitis, but some sort of prostate problem? And he says, well, you tend to blame the organ you have. If women, you will never blame a woman or tell a woman they have prostatitis or prostate cancer or BPH because they don't have a prostate.
Hmm.
And that's to say that you can have an enlarged prostate and not have urinary symptoms.
Hmm.
You have a small prostate and have urinary symptoms. And it's all about the squeezing in the middle, where the urethra tube that brings out the urine. If they're
Hmm.
squeezing, you're going to have a problem. If there's no squeezing, this is despite of size. Yeah, of course, if
Hmm.
you have a 300-gram prostate, it's big, and you're going to have other. And then it's prostate cancer, what's the takeaway there? One out of every 6 men will get it. Oftentimes you can die with it and not from it. And it
Yeah.
behooves the person and the clinicians to say, all right, who is the person that can die with it, not from it, so that we're not treating overly aggressively. One of
Yeah.
the bigger problems within the last 10 years that we've noticed is over treatment for prostate cancer. These are people who will never die from it. So who's that candidate? Who's that person? So there's a whole process to see who needs aggressive treatment and who doesn't.
Hmm.
I'll end there. I can always talk a whole lot more.
Yeah, it's great. And so is it basically inevitable that we're going to get BPH as we age? Is that just the trajectory of the male body, the enlarging of the prostate? Now, whether or not we get cancer is a different story, but is it just like it happens? And now that may or may not result, as you shared, with urinary symptoms, but is this just what happens, normal trajectory of the body, or is this a pathological process to some extent?
I think it's a matter of opinion. So if
Okay.
you ask most urologists, they'll say, "Yeah, everybody will get BPH after a certain age." In other words, is it nature or nurture? I
Hmm.
think that a lot of it is our lifestyle and a lot of xenoestrogens and the environmental estrogens that are causing that are very these are things that are in our environment, plastics or whatever, where now we have these estrogenic type chemicals in our bodies that are causing problems, including enlargement of the prostate. I
Hmm.
know that a lot of it is blamed on DHT, dihydrotestosterone. So that's a
Yep.
conversion of testosterone to DHT. There's drugs to bring down DHT. I don't
Yep.
recommend them. I think
Yep.
they cause more harm than good. I think they cause femininization in men,
Hmm.
tender breast tenderness, low libido, and I think
Yeah.
they're more of a problem. Um, so I think so to answer your question, metabolic syndrome, right? So
Yep.
these are men that oftentimes have a lot of fat in their body.
Yeah.
Some of them are slim fat, and there's a lot of conversion from testosterone to estrogen, and I
Mm-hmm.
do think that plays a role. So I think is more from a hormonal perspective, Anthony. I think it's more of
Yeah.
a testosterone to estrogen ratio than
Yeah.
just testosterone or estrogen. Yeah, it's typically an elevation in estrogen, and that's more, in my opinion, that's more lifestyle related than anything else.
That's good. And I want to hang out here for 1 second and add a little bit of my clarification. Then you'll clarify my clarification, please.
Yeah.
So, testosterone, all guys know what it is. Master male hormone, does so many different actions, gets converted, some of it to DHT, dihydrotestosterone, which is the thing that people say leads to male pattern baldness, as well as potentially the enlargement of the prostate. But you're saying drugs like Propecia, or finasteride is the actual chemical name. These are taken to block DHT, but that's actually problematic in your opinion because it harms these different body systems, and it may be not counterproductive. And effectively, it's our environment and multifactorial, but a lot of the stuff in our environment right now where we have too much estrogen in our bodies from chemicals or just from bad metabolic health, meaning we have this different ratio of higher estrogen than we should. And it's fair to say, I think men today have higher estrogen levels from all these things. And that's really the most problematic thing. Is that pretty spot on?
Correct. So if we go through the trajectory of testosterone once it is produced, it attaches itself to receptors and it does its own thing.
Yeah.
And where you get all these manly things, voice,
Mm-hmm.
it's the receptors in the brain, so you're more assertive and
Yeah.
things. Or it converts to DHT, dihydrotestosterone. The thing is that dihydrotestosterone is also an important byproduct. It's significantly more powerful than testosterone,
Mm-hmm.
and there's a lot of male characteristics that come from DHT. So just
Mm-hmm.
lowering DHT, I don't think it's the right thing to do. Or testosterone is converted to estrogen. Again, a
Mm-hmm.
hormone that we do need. So it's not a
Yeah.
matter of just taking what's called aromatase inhibitors to reduce the amount of estrogen. We don't want to do that. We need
Mm-hmm.
good estrogen. But when it's too high relative to testosterone, it causes many health issues and prostate issues, including BPH.
Yeah.
And the other is metabolic syndrome, where these are men who are overweight or have a big belly,
Yeah.
hypertension, etc. They fit several characteristics that they have metabolic dysfunction. That
Yeah.
also is a big contributor. So I think that if you handle both things, you can successfully treat BPH naturally.
Nice. All right, let's dive into a little more of the estrogen thing because I think you mentioned a few aspects, but it'd be nice to nail this down a little deeper. So
Yeah.
I suppose like if you wanted to expose yourself to as much toxic estrogenic compounds as possible, what would you do? That might be an interesting way to approach it. Like, I don't know, like plastic bottles, certain
Yeah,
creams, like what would you do? So like,
yeah,
where are the main sources that people are encountering these? And then maybe along the way, the second part is like, what do you do to keep your life clean from these things?
right. Great question across the board. Um, so you have estrogenic compounds in the environment. Even many of the pesticides that are sprayed on our foods are
Yeah.
estrogenic in nature. You see correlation between high intake of sprayed foods and
Hmm.
male infertility and even testicular cancer and things like that.
Yeah.
So I would eat organic mostly
Hmm.
or local, typically local fruits and vegetables that come from local farms are not really sprayed much. But
Hmm.
they don't want to play the USDA game for
Hmm.
the organic stamp, but they're typically good. Um, or eat organic, or you look at the environmental working groups, ewg.org, and they tell you
Yep.
the dirty 15, and so
Hmm.
those you eat organic and the other ones are fine either way.
Hmm.
Plastics are an issue.
Hmm.
Plastics, this is, and more importantly, I think is if you have a plastic bottle of water, leave it in the
Yeah.
car in a hot summer day, and
Right.
then now you drink that water, there's a lot of those chemicals that seep into the water itself that you consume.
Yeah.
And these are, bisphenol A and phthalates and things like those
Yes.
sorts. Um, so what I would suggest is metal containers. You just refill your water in metal containers. That's just the
Hmm.
easy way to do that. And, if you're very health conscious, like I saw you drinking something there that didn't look like water, it would look
Yeah.
like you had something in it.
Yeah.
I'm always, putting something in my water of some
Yeah.
sort, so you could just mix it up, mix it in there and shake it and drink it. I think that's an easy way to lower the amount of
Mm-hmm.
estrogenic compounds in the body.
Mm-hmm.
Um, and what do I do? So I do those things. I do, my water and my drinks are in metal containers.
Mm-hmm.
If I'm in a crunch, I'm fine with having a plastic bottle of water. The harder the plastic, the less of the chemicals that seep
Right.
in. So I don't, I'll name some names. I don't use a lot of Poland Spring, is like soft water, but I would
Yeah.
do Fiji, and I know this, or something of Avion or something, which is better quality water in my opinion. Plus, is a
Yeah.
the harder container,
Yeah.
and so I usually go for those. Um, and I think, yeah, I mean, from an environmental element, you could go a little crazy, like
Mm-hmm.
don't touch receipts because receipts have chemicals in them that
Mm-hmm.
seep into your body. I don't touch receipts much anyway, but if I touch, I'm not going to go crazy over it, right? Because
Yeah.
there's an environment, there's chemicals in there that are estrogenic as well. Let
Yeah.
me tell you what I don't do or recommend to not do.
Mm-hmm.
I think that I'm against the demonization of food, right?
Yeah.
So one group, talking about don't eat meat, and the other group talking about don't eat soy.
Mm-hmm.
I don't think soy is a problem for estrogenic issues,
Yeah.
though there is many of our foods have phytoestrogenic compounds in them. Many,
Right.
and it's not just soy, and it's not that simple that if you just eat these foods that are higher in phytoestrogens like diazinon or anything, that they will cause feminization or
Right.
cause a higher increase in estrogen. Is not that. Do I recommend fake food? So soy ice cream and soy this and hot.
Mm-hmm.
No, but
Yep.
if people want to eat tofu, I let them eat tofu. I mean, I'm not
Right.
crazy. I don't go crazy with it.
Yep. I've landed the same place as
Have
you.
you?
100%. Yeah. I mean, in non-organic soy and the stuff that's sprayed, like one
Yeah,
of the main pesticides is atrazine, and
yeah,
that stuff is actually estrogenic. But
right.
yeah, I have tempeh right now in the fridge. Now, granted, it's not my favorite thing to eat because I haven't made it in a while, but it's like fermented soy, and that's good to go. Soybeans, fine. And yeah, the whole soy scare, like you said, like these things have estrogenic compounds, but actually they bind to the estrogen receptors in a weaker way than actual estrogen. So they have like modulating effects. And I think some of the research and the case studies of people having issues were like the men drinking an insane amount of isolated soy protein or
Yeah,
gallons of soy milk. It's like out of the realm of what would actually be there. So yeah, I like that. And then I think microwaving too. Microwaving the plastic is a bad idea.
yeah,
And I know you kind of talked about that, but like don't heat plastic and try
yeah.
not to drink anything out of plastic.
Yeah.
Thoughts on like perfumes or scents or stuff like that? Is that problematic?
I'm
Like
pausing here because as you learn what we learned, naturopathic school, life research, there's cultural elements that come along. Balduzzi, how much you grew up eating tons of freaking pasta. There's no
I
question about
did
it.
for
I mean,
sure.
bowls of pasta. And you probably eat little to none now, is my guess,
Yeah,
right?
for sure.
So it's like, what from those cultural things are we willing to give up,
Yeah,
right? We grew up with my dad wore cologne. My
yeah,
siblings, like, this is just the way you always smell cologne, right?
yeah.
So what so many of the perfumes have all these things, all types of chemicals that are probably phytoestrogenic.
Mm-hmm.
I wear some level of one of these colognes or something. Why? It's
Mm-hmm.
just one of those things that I have not been willing to give up. And then I
Yep.
did some of the natural stuff. It wasn't the same. So I was like, you know what? This
Yeah.
is the one thing, right? And of course, I test all the time. I'm testing
Mm-hmm.
my hormones all the time. So but if you want to really, so the way I work with patients is, and people in general, is this is the story, right? So if
Mm-hmm.
you're trying to eliminate, environmental estrogenic compounds from getting into your body, it's all these things, including perfumes. Now, if you're saying, yeah, I always give them some wiggle room. Is that what's the one thing that, this is, look, I don't want to get, my name is Balduzzi. I'm not going to give up pasta. Come on. I'm just not. I'm like, okay, so cool. So you're willing to give up some other things and not pasta, then it's great. So then how can we work with that?
Yeah.
Right? As opposed to giving it up,
Right.
gluten-free pasta or
Yeah.
the cleanest pasta,
Right.
Pasta that's not enriched, organic pasta is not enriched with folic acid because that's a problem,
Yep.
right? So how can we work with that? Similar, like if we were eating pasta in Italy as opposed to no pasta whatsoever, right? And this is the approach here. But to answer your question, there seems to be enough evidence showing that these perfumes have chemicals in them that are estrogenic.
Okay. That's good to know. And what do you recommend for guys who want to just improve their testosterone levels across the board in a natural, healthy way? And this could be different minerals and vitamins. This could be lifestyle practices like strength training, sleep. Like, what actually works to boost T levels?
So I boost T levels naturally in patients. I can pride myself in doing that because I see before and after, right? And I'm not opposed to TRT at all. I recommend TRT in some cases. Okay, testosterone replacement therapy. Okay, because it depends on a variety of things, right? So first thing, how's your sleep? And we spend like a half hour on their sleep. I wake up to urinate, and okay, so then let's figure out this urination problem.
Right.
So you don't wake up to urinate.
Yep.
Right? Because at the end of the day, you need to get to REM sleep to produce testosterone and to release testosterone. Period. End of story. Right? So REM is like that phase 4 of sleep. You need to get there. And every time you get up to go to the bathroom, then you have to start all over to stage 1 and then work your way up. So you never get to REM. Right? So let's figure that out. Sometimes there's things like allergies that they have. So let's figure out the allergies because now you're stuffed up and you're stuffed up at night. Sleep apnea, right?
For sure. I was thinking that, yeah.
Sleep, that's number one. What exercises? I don't want to talk about exercise. If we don't get your sleep down, all bets are, are gone. So sleep. All right. Then what? Now, it's very important to know that what we really want is enough free testosterone. That's key. Because you can have, a lot of total, but not enough free. And sometimes there's overstimulation of SHBG, which is sex hormone binding globulin. And that is the protein that attaches to testosterone and it transports it around the body. And sometimes it's just too much of it, or it clings onto it too much where now it's not free. So we want enough free testosterone at the end of the day. So let me come back. So normal testosterone, when you look at any lab, is somewhere between 300 and 1,000 nanograms per milliliter. That's a huge wide range.
Yeah.
So somebody comes in, look, my testosterone is not under 300, it's 400. I don't care how much of it is free. At the end of the day, how much of it is free? My testosterone is 800, but man, I don't feel right. How much of it is free? Period. End of story.
Yeah.
Okay. So that is the key indicator. So sleep. All right. Then what? Then is exercise. So what I've learned through research is, go exercise, not just go exercise, is more or less 10 reps times 6 sets, 2-minute rest with stimulating big muscles. So any back and, lower limbs. So if you do bicep curls and you do that, that you're not getting it. But if you do back and legs, 10 reps, and it's no less than 10 reps 6 times. So it has to be enough weight for that 10 to get to that 10th rep. And that 10th rep should be, a little bit challenging. You probably have another 2 in you, but that's it. But you stop at 10, 2-minute rest. That seems to, I'm pausing here once again because there's a lot of components to obtaining the benefits of testosterone.
Right.
So we already said we need enough of it to be free, right? We also need enough receptors.
Yeah.
And those receptors need to be strong for the testosterone. These are called androgen receptors for the testosterone to bind, right? So exercise, weightlifting, some research says that I get, when I give talks, it's like, well, there's no evidence to show that exercise raises testosterone. I said, well, if you do what type of exercise, what type of weightlifting? So weightlifting, when you do it, big muscles, 10 reps, 2-minute rest times 6, you can get more testosterone.
Mm-hmm.
If you do any other type of weightlifting, the study suggests that it stimulates the receptors,
Mm-hmm.
and they're more sensitive to the testosterone.
Also
So
great. Yeah.
also very important. So weightlifting exercise is important, to make a
Mm-hmm.
long story short. When you do ultra marathons and things like that, it lowers testosterone. Now, I don't know
Yeah.
if it stays low, but it tends to lower it
Mm-hmm.
significantly. So, I'm more in favor of weightlifting and then very light cardio workouts. And then there's botanicals and things that help with either the production or lowering cortisol or modulating SHBG. We could go into
Yeah.
those if you want.
I hope you're enjoying today's podcast episode. I want to ask you this. Do you ever feel sluggish or mentally foggy? If so, your body might be craving essential minerals that are lacking from our modern food supply. Well, I want to tell you about an amazing mineral supplement that I've been using for the past year. It's called Beam Minerals. Beam Minerals offers a superior mineral supplement packed with fulvic and humic acids, which are two powerful plant-based compounds that do far more than just replenish your minerals. Studies show that fulvic and humic acids enhance nutrient absorption, boost cellular detox, and support energy production. And unlike other supplements, Beam Minerals delivers bioavailable ionic minerals in liquid format, ensuring your body gets exactly what it needs. I've been using Beam Minerals every day as my go-to mineral supplement. I pour 1 ounce of their liquid minerals into my morning water, and I smile because I know I'm giving my body the research-backed minerals to reduce inflammation and improve my overall well-being. Upgrade your health today with Beam Minerals. Visit beamminerals.com/fitfamily to learn more. You can use code FITFAMILY at checkout for a special discount.
A couple comments is it's always been my understanding, and I think you kind of spelled this out, especially with the sleep connection and then the exercise connection, that testosterone and cortisol are a little bit on like the seesaw relationship. When cortisol is high and there's a lot of stress in the system, that testosterone total could be lower, but certainly sex hormone binding globulin gets higher. So you have less bioavailable testosterone when you're stressed. And that makes sense why you must fix sleep first, because okay, you keep sleep messed up and then you try to throw high intensity exercise on top of that, it's never going to work. But if you sleep well and then you're able to do like this adaptive kind of stress mechanism with good exercise, then that's helpful. So I think that's important for people to understand. Is that proper?
That is excellent. Yeah.
Okay. Let's talk about some of the botanicals. There's a couple that I've always been a huge fan of. Ashwagandha, it's a popular one. Maybe some nettles. Like, I'm sure I know you know a lot more about this, but like, what are some of the things that people can take if they want to do a natural approach to raising total T in direct and indirect ways, and then also improving free T?
Excellent. There are other elements that we skipped over, and that was my fault. It includes the health of the Leydig cells of the testes. So these are the cells that are specific to the testicles. You need to have enough of them, and you need to have them in abundance for them to produce testosterone. Right. So all these things are important. Botanicals, ashwagandha, I think is a great botanical adaptogen. Mm-hmm. It modulates stress chemicals, particularly cortisol. And has shown to increase where people have more testosterone, likely from just lowering cortisol is the mechanism that I think of how it works. So ashwagandha is one. Tongkat Ali, good evidence to show that it increases total very nicely.
Yep.
Nettle root actually lowers SHBG. Yeah. So I usually I don't have it in a formula. I want to give high dosages of nettle root at about 500 milligrams twice a day, if not 1,000 twice a day, to lower SHBG. I like cordyceps quite a bit. The research there is well, in animal studies, and again, is animal studies, but it shows that it nourishes the Leydig cells of the testes. So and the androgen receptors. So there's better androgen receptors from cordyceps, which is a mushroom. So I like cordyceps quite a bit. Some that I don't that are popular in our herbal world that I don't use is is tribulus.
Mm-hmm.
So I think tribulus might be fine. Research doesn't indicate that, and my experience does not indicate that. But
Mm-hmm.
some people say, "Hey, I took tribulus," and it's anecdotal, but maybe there's something there. So I
Mm-hmm.
don't do a lot of tribulus for
Yeah.
that. I think tribulus is actually an excellent anti-parasitic herb, right? So maybe for those things is better. Another one that's popular that I don't use, and it's weird because it might work, but people that are scientists are talking about it like if it's like there's a lot of good evidence. I'm like, wow, I consider this guy to be a scientist, and there is no good evidence. So where are they
Mm-hmm.
getting? It's Fadosia,
Mm-hmm.
agrestis, an African botanical, a lot touted. You find it out. I'm like, where is this information coming from? There is no good evidence to show that this herb, and I have not tested it. So if it works, it might. Not everything that is not tested doesn't mean it doesn't work, right?
Yeah.
But I have not seen. I have not seen it. So, but the ones that I do use is Tonkat Ali, ashwagandha, cordyceps, and by the way, many of the adaptogens, rhodiola.
Yeah.
My favorite is ashwagandha, but I think
Mm-hmm.
rhodiola is just a great adaptogen as well.
Nice.
Um,
And what
did
about
I
the
miss
minerals?
anything?
Zinc, mag,
Uh,
like boron,
yeah,
these types of things?
yeah. So magnesium, zinc, and boron all tend to free testosterone,
Okay.
right? In one way, zinc is actually good for the testes in
Mm-hmm.
terms of testy health and Leydig cells health. Magnesium and boron. So
Mm-hmm.
those and vitamin D.
Yeah, for sure. That's
I'm
a
sorry,
big
you said
one.
minerals, but that was vitamin
Yeah.
D. Yeah.
I'm glad you brought up vitamin D. I think like that's something that people should be getting on blood tests all the time whenever they get blood work, because if that's not optimized, I have seen that when vitamin D levels go higher, test goes up. Is there what would you say a goal vitamin D level should be on a blood test that you like to see for male optimization? And I'm curious what the number falls for you.
40 to 60 nanograms per milliliter.
Nice.
That's a good number. That's a good range for me. If they go to 70, I'm not afraid. I'm okay if they go to 70. If they go over 100, I'm like, why? And it's more
Yeah.
like, why go over 100
Yeah.
nanograms per milliliter? So 40 to 60 is a good number, a good range, I think.
Nice. That's great. Thoughts on light, red light, or using any kind of lights on the body or testicles? Is there any science on that?
Not that I've seen. It's very interesting because I get asked all the time, of course, and people are doing it. I said, well, keep doing it. Red light therapy to the testicles, right? Keep
Yeah.
doing it. I think that, it's almost like in theory, you would think it doesn't work because you don't want to heat the testicles, right?
Mm-hmm.
I have not seen. I'm curious. I think you are an adapter, Anthony. If I remember from our
Mm-hmm.
last conversation, I'm curious to know what you know about it. If there has been any research, again, not everything needs to be research and it works.
Yeah.
In other words, why would you recommend it to someone? First of all, there's only so many things one can do, right?
Yeah, for
Right.
sure.
So to me, it's like, no. Let's get our sleep right. And
Yeah.
that alone may take a while. All right, we got that. All right, get in the gym. Oh my God, a gym. I haven't been to a gym. Right. So then now add, so
Yeah.
I'm curious to know your thoughts on it.
My thoughts are like, I think ideally exactly what you said. It's the tip of the iceberg of optimization that red light and infrared will have a lot of benefits to the skin and the energy centers. And there are some case studies of people showing that when they expose their testicles to red light on a regular basis, it seemed to improve their lab levels on testosterone and vitality. But again, I think we're playing in the optimization range. And for like biohacking stuff, it's probably beneficial. But even if it gave you an effect, I mean, I would guess the effect size is maybe like 10 to 15% boost. Whereas if you improved your sleep and your training and your nutrient intake, you might get like a 30% plus 40% plus boost if you're deficient. Right. So, I think we're going to see more research.
I think you and I, many of our listeners and audience, we have a proactive audience, I think. So my audience, they're ready to do whatever it takes.
Mm-hmm.
So, but are they going to kind of lay around, hands behind their head while they're red light, It's like, all right, you got to really show me that the next 20 minutes I should be doing this, right? Because I have a lot of things to do. So it's that kind of thing, right? It's like, where do I put my time?
Yeah. I mean, I have a red light panel, and I've only on a handful of times red light my balls. Like, it'd be a lot, right? I mean, there's a lot of factors that get you to that scenario.
Yeah.
Naked in the house by yourself for 20 minutes, both sides. It's like, there's a lot, right? I mean,
Do
so,
you have children? I mean, children,
right? Yeah, for
oh,
sure.
wow, it's 2:30. They're about to get home. Yeah, turn this off quickly. I lost track of time.
All right. So different, similar, but different. Like, do you have a hot take on this, or the fact that people are keeping these little cell phones, microwaves in their pockets? Is that nuking the testicles? Is that causing damage? What's your take on that?
There's what we know and there's what I think. And I think what I think may have some value because I live in this world, right? So I think both there is research, not that I think, I've seen the research.
Yeah.
And what I think you want to keep cell phones away from your pelvic area at all costs.
I agree too.
Period. End of story. Keep it away from your body because then they put it in the inside of the jacket. And I don't know if it's affecting things in my testicles, if I have it in my front pocket. What if I have it in my jacket pocket? My heart is right there.
For sure.
I don't know. I don't know, right? Like, I don't need research on that to be like, it's a good idea to keep it, usually have it in my hand or have it in my bag.
Yeah.
My bag, because of course I don't want to always be interrupted.
Yep.
But keep cell phones, and I would argue laptops away from your testicles.
Yeah, I'm with you 100%. And I think that's a important thing that you brought up, because probably even the health conscious people listening to this have a cell phone in their pocket a lot of the time.
Yeah.
And it's something. I mean, I've seen the research too. It actually does affect the Leydig cells, and it does decrease testosterone levels, create oxidative damage, and affects mitochondria negatively. And it's crazy because that's something that we don't even think of.
Down.
Semen production goes down. Okay, so this is a nice thing. Now we're going to get it all, everyone's vices. Let's talk about marijuana and how that affects testosterone and testicles and all that.
So, you got to look at the research the way it is, and then you got to look at life the way it is. Like, people are going to smoke, right? Like, people that are going to drink are going to drink. Now, if they have an alcohol problem, they should stop drinking. But, if that's not the case, men will drink. Weed, marijuana. When it seems to lower testosterone. The question becomes then, how much, who, if I smoke 3 joints every day, 7 days a week, versus 1 joint. And by the way, I have unlike the perfume question, I don't.
No dog in this fight, okay?
No dog in this fight. I just want to, right, exactly. I just want to do the right thing for people and take my bias away. This is why, if I have a vegan coming in, I was like, all right, how can you eat the best vegan approach? What's the best vegan approach where you actually get enough protein in, right?
Yeah.
If you are I haven't had too many carnivores come in, but certainly paleo people and so forth.
Yeah.
So same thing with marijuana, right? I don't know, right? 1 joint every other day, only on weekends. I don't know. So I do think the poison is in the dose. I just don't know what that dose is.
Yeah.
So what do we do? Oh, Dr. Geo, I roughly smoked about 2 joints a week just to kind of take off the ease good. Let's measure you. Right. And what I've seen in those type of scenarios, like, haven't met too many people that smoke every day, or at least that come to the clinic. I know quite a few people that smoke every day, but not many that come to the clinic. Their testosterone, their hormone levels are fine. So I think it comes down to that more than anything else. If it helps them sleep or they have pain,
right,
I'm not gonna, opioids or marijuana.
Right. Yeah, it's definitely complex, right? For sure. Something I became more aware of on the marijuana front too, and I have partaken in the past, and I have seen benefits, but I don't use it now. And by the way, for the purpose of this, it is legal in Arizona, in case you're wondering. Yeah. It does actually create some damage to your endothelial cells, and particularly the ones that are implicated in producing nitric oxide,
right?
Which has a huge effect on everything. You want nitric oxide signaling to be great, and that's decreasing as you age. So there's an aspect of it there that is something to consider.
Absolutely. Again, what's the dosage? Look, if we go back to alcohol for a second, I've spoken a lot about alcohol in the last couple of years, done some deep research, and I've seen patients, and I've asked more questions than ever before on alcohol consumption, because they're not going to tell you. And a couple of drinks, that's all, a couple of drinks a week. Then when you dive deep, it's a lot. And what am I doing? If I'm saying sleep better, but I'm not finding out how much alcohol they actually drink, then what am I doing? That's going to interrupt their sleep, right? So it's the same thing with alcohol, where look, the poison is in the dose.
Yeah.
Now, and I have to look at it holistically. One of the biggest problems we have as men is engagement and interaction with other males. We were talking about
Yeah.
that before we started recording. If you tell me, hey, Geo, man, I got this bourbon. It's gonna knock you off your feet, man. You should come down, and we'll have a drink. And a couple of more guys are coming, and I'm going to have a drink with you,
Yeah.
right? That engagement,
Yeah.
it's for those that smoke pot, they say, hey, come on, we'll roll a joint and watch football.
Mm-hmm.
The engagement, the interaction with other men.
Yeah.
We men are suffering from loneliness, right?
Yeah.
So I think that unless there's a problem, unless you doing that once in a while and interact. So it depends on the scenario, I think.
Mm-hmm. That's a really good answer. I like that a lot. I see how both those scenarios, the benefits for someone healthy who doesn't have a problem would absolutely outweigh the risks. And risks aside, just like it's really great to connect with people. And there's a reason humans have been using different substances to do that with people, because it's enjoyable and we can relax and connect with one another. That's great.
And we were talking before we started recording, I think that, my friend Scott, right? He's like, hey, I had this cigar that I went to Canada. I got the cigar. Well, let's smoke a cigar, man, and a drink. And it's a wonderful thing. And it's just engagement with a few guys. It is one, I enjoy it so much. And by the way, I don't wake up anyway, because I want to be very careful with how I sleep and how I wake up. And I'm not groggy. I'm not anything. I enjoy it. Stop early, stay hydrated. Boom.
Yeah. Yeah. I think that's the right way to do it. 100%. All right. Let's talk about penis health.
Oh,
and
yeah.
Like, I think that's just like whatever you like to share
Penis
about that,
length
obviously.
or penis health?
Both. I mean, both. But I think like mostly just like a lot of guys experience a decrease in libido and certainly like fullness of erections as they get older. Like, let's talk about the approach of how to keep the penis healthy, what some of the underlying problems are going to be, and if the approach to getting a healthier penis and having just healthier anatomy down there is different than anything we've shared already, or pretty much the same principles.
Some of it are similar to what we shared already. Here's how it works. To get an erection, you need enough blood flow going into the arteries of the penis. So you need good endothelial health.
Yeah.
Right? So this is the inner lining of the arteries. You need enough nitric oxide production, right? And then the penis engorges, enlarges, and you get an erection. You also need venous occlusion, right? So the veins need to kind of close in so that you can keep, not only get an erection, but keep an erection until you reach orgasm. That's so you need the vein to kind of shut off, so that the blood stays in the penis, right? And how that process happens is in many ways. There's also nerve conduction that's required. So there's nerve conduction. Blood then goes to the penis. Veins shut off. Close in. You get an erection. You get an orgasm. Veins open, and now the blood goes back into your body, the rest of your system, and you get flaccid. So, like I said, you need endothelial health. What some people have trouble with, some people would complain of, hey, I get an erection, but I cannot maintain one. So, and this is before I ejaculate. So my penis goes flaccid. That's about, there's problems with the venous component of things. So this is called leakage, venous leakage. And that's caused primarily by testosterone estrogenic ratio problems. Testosterone too low, estrogen too high. So that's the first place you want to look at is a testosterone problem, because the testosterone is an excellent. There's many benefits, but one of it is that it attaches to the vessels of the receptors of vessels of the penis, and part of those vessels is the veins of the penis. So in that situation, you want to kind of fix that ratio, if you will. Typically, lower estrogen, raise testosterone. All right. I don't know. erection talk can go on for a long time. There's a psychological element to it, of course. Some guys, there's a lot of performance anxiety issues. I get a lot of guys, oh man, I couldn't get it up. Yesterday was the worst. And then they go into the next time and they can't get it up. Relax. So I think what men need is context. They think they're in their 40s or 50s, perhaps. It's like, it's not like when I was 25. Of course, it's not like when you were 25. Or they're single and they get with someone, let's say a female who they're not really into, but they just trying to, have sex with them, and then they don't. I couldn't have sex with it because you're not into her. Let's not overcomplicate it. If you were into her, but wow, I used to be able to. Yeah, I know. Yeah, at 20, it didn't matter. It matters now, though. At 20, you could go to bed with anyone and you get it up. Yeah, not anymore. But that doesn't mean that you have an actual physiological problem. Right? So there's all these components that are really important. But at any given time, any man, because we have a lot in our heads, would not be able to get an erection or a full enough erection for intercourse. And it's okay. Don't make it a big deal, because now you have oversympathetic stimulation, and then it will become a big deal later on.
Yeah, that makes total sense. A couple questions that come off of that. One, what's your take on guys using Viagra, Cialis, or any of these drugs to increase nitric oxide? And if so, is it good? Can they use it often? Is there health benefits, risks?
Yeah. These are under the category of PDE5 inhibitors, right? So, Cialis, Levitra, Viagra, right? I have no problems with many of these things, just like TRT. My nature is nature. My nature is nature, right? What's happening? Why can't you get an erection? Let's figure that out, because it could serve as a Band-Aid. What if you can't get an erection because you have cardiovascular blockage or something, right? So I don't want to mask any symptom, right? ED is a symptom. I don't want to mask that, right? That said, I don't have a big problem. Lately, my favorite is tadalafil, which is Cialis, low dosage. I think that can actually be used a little bit like a supplement, where it could be very healthy, and there's health benefits to the prostate as well. Studies show. So I think low dose Cialis or tadalafil, I use it as a supplement oftentimes. And if that's not a good enough dosage to get an erection, then I use that with a natural supplement combined that I believe in. And oftentimes that works.
Gee, I'll tell you something. I'm a natural focus guy as well, a naturopathic physician. Is the only pharmaceutical that I take is 5 milligrams of tadalafil. And I don't take it every day, but when I remember, I do. So just a little bit of Cialis. And I guess my take on it is this just generally increases nitric oxide throughout my entire body, which just gives me better blood flow to my brain, to my cardiovascular system. I found that my exercise capacity went up, and it's not like I experience any benefit to erection at that point. I just have good blood flow generally. And I saw some headlines of people saying, is tadalafil the new aspirin of the future? Many people take these preventative baby aspirins to just thin the blood, and maybe tadalafil is something like that.
Correct. And there's a prostate benefit too. Like a lot of guys I'd rather put them on that way before finasteride.
Yeah.
I never put anybody on, anyway. So I'd rather put them on that, on tadalafil versus any other of these prostate drugs.
Nice. Okay. So I want to kind of go in full circle and talk about prostate cancer. Like, how scary is that for someone to find out that they have prostate cancer? And then another question, in whatever way you want to take this, is what can guys do to not be the one of 6 men who will get prostate cancer? Like, what are stuff? Is there something that you can do to keep them out of that, lower their risk and stay healthy? Like, what's the cancer prevention strategies as it relates to the prostate?
So how scary is it? Not scary at all. But that's easy for you and I to say. These guys go crazy with their PSA, which is the biomarker for the prostate. They just go nuts, and that number goes high, and they're going crazy. So I can say whatever I want. Guys go, it's the first time they are brushed with their mortality, right? It's the C word. The question is not how do we reduce the risk? Because, most men will get it. The question is, how do we reduce the risk of aggressive prostate cancer that can potentially kill me? Because if I go and biopsy, 10, 60-year-old plus men, about 60% will have something. But these are
Yeah.
things that I don't want. It's low risk prostate cancer that no one wants to find. On my podcast, I have a Dr. Geo podcast. I have a talk with Dr. Scott Egner, who's from the University of Chicago, who says Gleason 6 prostate cancer should not even be called cancer. Like low risk disease, why call it cancer, right? So if you go by the current standards of definition, yeah, everybody will have cancer. Question is, how many people will have aggressive cancer that can be life-threatening? It's about 20%. So my job, a big part of what I do is determining who, before biopsy, because that's another thing. I just don't want everybody to get biopsied if they don't need to. Who is at risk for higher risk of prostate? So there's a whole method of doing that. But that's what you want to know first, And do I belong in the 80%, or am I part of the 20% where I need to find out? So that's that. In terms of what to do naturally, a lot of the stuff, actually, there's a lot of correlation with what we already spoke about. I think that, I think exercise is some serious anti-cancer medicine, man. You produce exosomes that are anti-cancer in the body. The cancer cells dislike an exercised body, a body that moves a lot. You're trying to create a microenvironment that's hostile to cancer. Exercise is that. So many benefits that, again, we can talk an hour just on the benefits of exercise for cancer. So that's that. In terms of diet, I could tell you that ketogenic diet does not work for prostate cancer, because I know that a lot of people listen to Thomas Seyfried, which is great. I hope to have my podcast, but is a different metabolically. These cancers are different compared to brain cancer or glioblastomas or something.
Yeah.
So a plant-based, you don't have to stop eating meat. That's the other misnomer or misconception. You don't have to stop. But you want a plant-based approach. I think that's better for men with prostate cancer. And honestly, a lot of it is just don't eat too much too. I think just we eat too much.
Yeah.
Practice some level of intermittent fasting. And then again, sleep. You want good melatonin production. Melatonin has anti-cancer activity.
Yeah.
You see guys with low melatonin metabolites who have high risk prostate cancer. There's been correlation with that. And in terms of supplements, I use anything that helps the microenvironment, right? So lower chronic inflammation. I'm a big curcumin guy. I like Boswellia, quercetin, excellent for the prostate. What else? You need mixed tocopherols, vitamin E, selenium, all these. By the way, selenium is also pretty good for testosterone as well.
Nice.
The four pillars is sleep, diet, targeted nutraceuticals, and exercise. How about stress? You didn't say stress. The truth of the matter is that if you do these four things right, you stress less.
Yeah.
Right? You stress a whole lot less when you do these four things right. But stress is a factor. There's no question about that. I was at a conference recently, and somebody spoke. It's a conventional conference, and they said, look, there's a love-hate relationship with the nerves around the prostate and the prostate. The nerves around the prostate, particularly the sympathetic nerves, they are part of the microenvironment that is involved in the spreading of cancer. Holy shit. This is in a conventional setting, and they're having these conversations. I'm going crazy. I'm absolutely going crazy.
Yeah.
Because I'm all about microenvironment.
Yeah.
And so there is this, and they notice that sympathetic nerves in patients with prostate cancer are thicker, more dense than the nerves in benign tissue.
That just tells you this is a long-standing process of non-stress management that has caused those nerves to basically hypertrophy.
And it be involved.
Yeah, and be involved
in the progression and trend and spreading of these cancer cells.
And then there's cortisol, which would raise in conjunction with the stress, which crushes the immune system.
Right.
And then you may be on your phone in your pocket
Yeah.
because you're busy all the time. It's like I can see how this all snowballs for sure.
Yep.
Yeah. All right. I mean, this is like
that's pretty much that's it. I mean,
yeah.
that's
Well,
not it, but that's it.
yeah.
An overview.
It's good.
Yeah.
I think everyone who's listening to this point has a lot to chew on. And now my final questions are going to be more asking you as a dad and a fit father yourself.
Right.
So like what as a dad, like what is your guiding philosophy on how to raise your kids? And tell us about your kids too. You have a daughter, at least one daughter, maybe two.
So those are the things that I talk about, right? I talk about mental health, and I talk about what I call fathering.
Yeah.
Right. The action to being a father. I have two daughters, 19 and 18, and an 11-year-old son. So full spectrum. And how do you raise daughters versus son and all these things? That's a conversation, right? Though there's not much of a difference, because when I had the two girls and I had them for a while before my son was born, I was like, well, you raise them like boys. I'm not sure exactly what the difference is. If I have a football, they're going out for a pass. They don't have a choice. I mean, so that's that. I could say that, let's see. Here's the thing that when young fathers who reach out to me to say, hey, man, help me out. I have a 2-year-old conflict with my wife because of the 2-year-old, her philosophy, my philosophy, and things like that. And I know you're into fathering. What's the thing? All right. Again, that could be a whole podcast by itself. What I would say is, and this is the thing that's resonated with a lot of guys, is quantity of time with your kids is more important than quality. Is more important than quality. Be around. It's okay if you're around and you're answering emails on your cell phone. You got to work. Life works the way it works. Be around. Naturally, if you're around, then why do I say this? I see a lot of guys out of the house too often. Whether it's business trips, or they create a business trip it's not really a business trip, or they extend their work hours more because they just want to be. And I get it. Home life could be tough depending on many things. Your kids need you to be around, and make it to soccer games and baseball games on the weekends. Be around and take them to the travel game that's 2 hours away, because that's the time there that something happens. A conversation that's important to have. The goal is to get into your kid's mind and figure out what is their story and fix the story before the false story becomes a belief.
Yeah.
And now they're behaving in a certain way because they're believing X, Y, or Z because the story has never been fixed.
Yeah.
And the way I believe that the way you come around that and you get and you sort of fix that, it's just by being around. Even if the time is, many times my kids are there and I'm answering emails, low level, doesn't require a lot of thinking, but hey, you good? Okay. Yeah. Okay. Yeah. That had a good, okay. And so it's just things come up, and there's no, oh no, Friday night at 8 p.m. we're going to have dinner and then they're going to talk. No, they're going to talk when they want to talk. And there are times that you're asking them and they're not talking. Right? Quantity more important than quality. From quantity, you may get quality.
That's cool. I love that. It's really interesting take. Next question to kind of dovetail on that is, how do you guide your kids to healthier habits and a healthier lifestyle? Like, are you doing it overtly, covertly? I mean, they've been brought up under your influence, and obviously you live this stuff as well as teach this stuff, but also maybe advice for guys who want to lead their families and their kids to healthier habits. Like, where do we start as fit fathers?
Show them, don't tell them. First thing I did when we moved into this house is I created a garage gym. Right? Dad, I need, I'm going to have this. Oh, you need? Yeah. Why don't you come into the gym and let me know what you need? Yeah. Go ahead. Do a couple of reps. Oh yeah. What do you need? right? Little bribery, I guess you want to call it. I don't care. It's like, this has to become part of your wiring, and then we need to make it that. And I am showing you that I do this every single day in here, right? And this has to become part of your DNA.
Yeah.
So don't say go work. You got to show them health and fitness, and by example, they need to see you come back from a run.
Yeah.
So that's it.
I love that. And I actually think the exercise thing is almost the better way with the kids, because if they're not moving, they're not going to have the healthy neurochemistry that's going to make them excited to eat healthy food. But if they feel like they're investing in their bodies and exercising, it's going to make them more likely they do the healthier food. And like the laziness of not moving is this snowball thing for kids. So I love the fact that you have a space at home, the home gym, where they come, it's wired, it's baked in. They know they want to be strong. They know that you are strong. And I'm sure that has a cascading effect. So
kettlebells around.
Yeah.
Something.
Yeah.
Baseball bats, take 2-3 bats and swing.
That's cool.
Baseballs. All right, he's a catcher. All right, catch here, dude. Come on. That's we're watching. Whatever together.
Love that. All right. Well, I mean, this was an amazing hour conversation. I mean, we covered a lot of topics, and there was so much great actionable advice here. And I know someone still listening to this is excited to connect with you further. And so you have an amazing podcast, Dr. Geo Podcast. You have the YouTube channel, so tell us where people can connect further with you and continue this journey of improving their health, and especially under your guidance.
I appreciate that. Thank you for the opportunity, Anthony. I really appreciate it. drgeo.com is where you find everything regarding my work, including information on the podcast, which it's taken off pretty nicely. I've been in it for 2 years, and it's doing very, very well. I think as key things that are important for men to take care of themselves that they're not going to hear anywhere else. So drgeo.com, that's drgeo.com.
Nice. Amazing. Highly recommend your podcast, because you get a wide range of obviously health topics, but all this deeper connected web stuff from a very wise man on many fronts. I respect you deeply, Dr. Geo. Thank you for your time today. Our entire Fit Father community appreciates you.
Likewise. Thanks so much for having me.
I hope you enjoyed today's podcast episode with Dr. Geo Espinosa. If you enjoyed this episode, please do me a favor and head on over to our Fit Father Project YouTube channel, subscribe, and leave us a comment on one of our recent videos to let us know. And ideally, like our videos too. It helps us connect on YouTube to spread this amazing information, and just helps the Fit Father Project grow and reach more people. If you listen to this podcast and you're listening either on Apple or Spotify, please take a minute to actually rate and review the podcast. Give us a 5-star rating if you're loving this content, because again, you taking this small minute to actually do the rating and review helps get this podcast into the algorithm so more guys find this information, and you're literally helping me and the Fit Father Project grow, and it means so much to me. So please subscribe on all the channels, leave us a comment, rate and review on Apple or Spotify or wherever you listen. I appreciate you so much, my friend, and I'll catch you in upcoming episodes.
Thanks for listening to this week's episode of the Fit Father Project podcast. If you love what you heard, please rate and review our podcast on Apple Podcasts. It really helps spread this show to more men who need this valuable info. To watch full video episodes of this podcast and other motivational videos to inspire your training and more, visit our Fit Father Project YouTube channel. It's free, and everything's made for busy guys over 40 like you. Visit youtube.com/Fit Father Project to get access to our entire video library. And finally, if you or someone in your life is interested in becoming a fit father or needs help losing weight, building muscle, and living healthier after age 40, then visit fitfatherproject.com, where you can see our proven programs, supplement line for guys 40 plus, and free meal plan and workouts to get you started. This is Dr. Anthony Balduzzi signing off. I'll see you in the next episode.